Hi everyone, Dr. Sadaf Qureshi here, and today we are going to talk about middle cranial fossa. As we know, cranial cavity is divided into three parts: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. In last video, we talked about anterior cranial fossa in detail, and today we will talk about middle cranial fossa in detail, and in next video we will talk about posterior cranial fossa in detail. So, starting our today's topic, that is middle cranial fossa. The part that is colored in diagram is middle cranial fossa. Now we see the whole cranial cavity there. We see anterior cranial fossa, middle cranial fossa, and posterior cranial fossa. Now the colored part we are seeing is middle cranial fossa. Middle cranial fossa is separated from anterior cranial fossa by lesser wing of sphenoid, and it is separated from posterior cranial fossa by petrous part of temporal bone. These two parts are really important for MCQs, so you should remember them. Starting our topic of middle cranial fossa, we will start our topic with the introduction. The middle cranial fossa consists of small median part, as you can see in diagram, and expanded lateral parts. The median raised part is formed by the body of sphenoid, while the expanded lateral part forms concavity on each side, and they are formed by sphenoid bone, temporal bone, and to some extent parietal bone. They lodge the temporal fossa of cerebral hemisphere. In anterior cranial cavity, there was frontal lobe of cerebral hemisphere. Now, in middle cranial cavity, there is temporal lobe of cerebral hemisphere. This is important point for MCQ. Now we will talk about bones contributing to middle cranial fossa. That what bones contribute to the formation of middle cranial fossa. They are sphenoid bones seen in orange color in diagram. Sphenoid bone body and sphenoid bone greater wing contribute in middle cranial fossa formation. Then the next bone we have in middle cranial fossa is temporal bone. Temporal bone, petrous part and squamous part are there in the middle cranial fossa. Then next, middle cranial fossa, if we talk about middle cranial fossa, it is related to anteriorly. If we talk about, it is related to the orbit. Laterally, it is related to temporal fossa through the foramen, and inferiorly it is related to infratemporal fossa also through the foramen. Now we will talk about the boundaries of middle cranial fossa. That what are the boundaries of middle cranial fossa? Middle cranial fossa is bounded anteriorly by lesser wing of sphenoid. Laterally, it is bounded by squamous part of temporal bone, greater wing of sphenoid, and the parietal bone. Then, if we talk about posteriorly, it is posteriorly bounded by petrous part of temporal bone. Moving forward, talking about the floor of middle cranial fossa. The floor of middle cranial fossa is formed by greater wing of sphenoid anteriorly, then petrous part of temporal bone posteriorly. So there are two bones that contribute to the floor of middle cranial fossa. That is sphenoid, that greater wing, and petrous part of temporal bone. Moving forward about the sphenoid bone, that is very important bone in the middle cranial fossa. It resembles a bat, and it is centrally placed body, and it has greater and lesser wing that are outstretched on each side, and that's the reason it resembles a bat. If we talk about body of sphenoid, it contains sphenoid air sinuses that line with mucous membrane. Now we will talk about the features of middle cranial fossa. So the first feature we are going to talk about is anterior clinoid process. It gives attachment to the free margin of tentorium cerebelli. Then we have sphenoparietal venous sinus that is located just below the lesser wing, posterior border of lesser wing of sphenoid, and it runs medially along the posterior border of lesser wing of sphenoid, and it then drains into the cavernous sinus. Then we have impression for trigeminal ganglion in the middle cranial fossa that is present lateral to the foramen lacerum, and it is basically an impression on the apex of petrous part of temporal bone, and it is for the trigeminal ganglion. Moving forward, the next feature we have is groove for greater petrosal nerve that you can see there, and then we have a groove for lesser petrosal nerve. Moving forward in the features of middle cranial fossa, here we can see the arcuate eminence. It is a rounded eminence found on the anterior surface of petrous bone. It is caused by underlying superior semicircular canal. Moving forward, we can see tegment tympani, that is thin plate of bone, and it is forward extension of petrous part of temporal bone, and it starts from behind the sphenoid bone. It forms the roof of the mastoid antrum anteriorly, then it forms the roof of tympanic cavity in the middle region, and then it forms the roof of auditory tube in the posterior region. So basically it is a thin plate of bone that forms the roof of mastoid antrum, then tympanic cavity and auditory tube, and it is part of the temporal bone. This thin plate of bone is only major barrier that separates infection in tympanic cavity from the temporal bone of the cerebral hemisphere. So that's the reason it is really important, and for the MCQ point of view it is also important. Now moving forward, we can here is the location for cavernous sinus. Here is area where cavernous sinus will be located in the brain. If we see the brain, so cavernous sinus is present at the side of body of sphenoid. It is important because it has many important structures that pass through it. Now we will talk about what are the foramens present in middle cranial fossa. So the first foramen we are going to talk about is optic canal. It is inferior medial to anterior clinoid process, and it transmits the optic nerve, ophthalmic artery and ophthalmic vein to the orbit. Now we will talk about the next foramen or next fissure, that is superior orbital fissure. It is a slit-like opening between the lesser and greater wing of the sphenoid. It transmits the lacrimal nerve, frontal nerve, trochlear nerve, oculomotor nerve, nasociliary nerve, abducent nerve, and superior ophthalmic vein. Then we have foramen rotundum. Foramen rotundum is situated behind the medial end of superior orbital fissure, as you can see there in the diagram. In front there is superior orbital fissure, and behind the medial end of superior orbital fissure is foramen rotundum. It perforates the greater wing of sphenoid, as you can see the it is perforating the greater wing of sphenoid, and it transfers the maxillary nerve from the trigeminal ganglion to the pterygopalatine fossa. The next foramen we are going to talk about is foramen ovale. It lies posterior lateral to the foramen rotundum, and it perforates the greater wing of sphenoid, and it transmits the mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. The mnemonic for this is male, that is mandibular nerve, accessory meningeal artery, lesser petrosal nerve, and emissary vein. So next foramen we are going to talk about is foramen spinosum. It lies posterior lateral to the foramen ovale, as you can see there. It perforates the greater wing of sphenoid, as the orange part is indicating the greater wing of sphenoid, or more specifically the sphenoid bone. It transmits the middle meningeal artery from infratemporal fossa into the cranial cavity. It is named because it is very close to the spine of sphenoid when seen from the base of skull. Then we have foramen lasum, that is large and irregularly shaped foramen. Foramen lasum lies between the apex of petrous part of temporal bone and sphenoid bone. The inferior opening of the foramen lasum is filled with cartilage and fibrous tissue, and only small blood vessel passes through this. Then we have carotid canal that opens into the side of foramen lasum above the closed inferior opening. The internal carotid artery enters the foramen through the carotid canal. Then we will talk about the sphenoid body. In front we can see sulcus chiasmata. It is related to optic chiasma, and it leads laterally to the optic canal. Then another feature in sphenoid body is middle clinoid process and tuberculum selae. Tuberculum selae separates sulcus chiasmata from sella turcica, and middle clinoid process give anterior attachment to diaphragma selae. Then in sphenoid body, the next feature we see is sella turcica that lodges pituitary gland. And the next feature we see is dorsum sellae, that is posterior boundary of sella turcica, and we also see posterior clinoid process that gives posterior attachment to diaphragma sellae. So this was all about middle cranial fossa. Hope you liked the video. If you like our video, don't forget to like, share, subscribe and comment. Thank you for watching.